When most people think of addiction treatment, they think of an outpatient facility or a support group. These might not treat the other issues that can be involved. Here to discuss how a hospital-based treatment program can be the best choice is Dr. Daniel Headrick of Mission Hospital in Laguna Beach.
We believe that every addict deserves a full medical workup. This is a life-threatening, chronic relapsing, treatable but non-curable illness. And people walk in with a lot of medical conditions that could be overlooked. And you'd be surprised at what we find. People have hepatitis C, they didn't even know it, cardiac conditions, lung problems, tumors, heart failure. I think they really deserve, if this is a disease, and it's a life-threatening disease, you need to be in a hospital, at least for the first 3 or 4 days to stabilize and get evaluated, and then you can move on. The sooner they go outpatient, the more chances they relapse, and we lose a lot of people when they go to the next level, which is ideally it's detox for maybe 3 or 4 or 5 days, and then 3 or 4 or 5 days of rehab, and then people, mostly for insurance reasons and financial reasons, start to go to partial hospitalization, which is they're there all day, 7 o'clock in the morning till 8:30 at night, and then they need a safe place to stay at night. Just that level, jumping to that level, we lose about half the people because there's stress and there's triggers and there's chaos and distractions, and it's hard to keep them on track. They're impulsive, you know, you can't even trust your own brain, especially that first 3 months.
How long should in-hospital treatment take?
Well, we try to give people a picture of 90 days. Not that they're going to be here for 90 days, but you got to start thinking about your brain is going to take 90 days to pretty much settle down. It's going to take years, actually, but the first 90 days is when you're on an emotional roller coaster and there's a lot of relapsing, and you can get depressed and irritable for no good reason. Well, your brain is deficient in your molecules of emotion. So it's set up as a 30-day program. A lot of that's been around for a long time. There's a detox phase, there's a rehab phase where you're really doing a lot of emotional homework for sometimes a couple of weeks, finding out what you're numbing emotionally: anger, guilt, resentment, inferiority, unworthiness, abandonment, abuse, poverty, grief, loss. People are numbing emotional baggage. And then we bring in their family. Usually on the 3rd or 4th week, we bring in their family and they stay for almost a whole week, knee-to-knee exercises, resolving a lot of old baggage there too, and educating the family members about what this disease is and what happens to the brain and how the brain heals and how long it's going to take. And most people that actually do a 30-day program where the family is educated and healed too, the majority of those people make it. If you're living with somebody with this addiction, if you think it is, to go and get some advice, and there's interventionists, or talk to a hospital like ours. There's an intake office that's available to talk on the phone and get some recommendations. And you can treat it like a life-threatening illness, but you don't want to be the doctor or the nurse or the counselor, just like you wouldn't do that if your loved one had cancer or a heart condition. You would tell them, you need to see this specialist, and at least you can try to get that person, your loved one, to go see a specialist in addiction medicine. And that whole stigma is changing. People are coming in sooner because of that. They're realizing it's an illness, there's a treatment, and treatment can work.